connective tissues. All right. So the nice thing about fluid connective tissues, there's two types: blood, which we're all very, very familiar with, and then lymph, which is just essentially drained. Well, it's the plasma portion, amongst other things. All right, that comes from the blood. All right. So let's start off with blood, and we'll kind of review. All right. When we're talking about blood, of course, most people think of a liquid. All right, but there's things that are in that liquid. Some things are dissolved, some things are whole. But regardless, we call those elements the formed elements. All right, that includes your red blood cells. All right, that's a formed element, which is made in your bone marrow. Okay, the white blood cells, which we also call leukocytes. And then we have all this other stuff in there. You got different proteins, you got ions, you got glucose, you got just all this other stuff floating around in your blood. Right? So when we're talking about blood, there's several different elements to it. We have our blood-formed elements, all right, and then the liquid part, which is the actual ground substance. All right, remember, connective tissue has three components. All right, it's got the cells, and then it's got the extracellular material. In this case, when we're talking about blood, all right, that's going to include the blood plasma, all right, and like dissolved ions and glucose and all that other stuff there. Okay, so the ground substance is the plasma. Right? A large component of your plasma is water, all right, but you'll see quite a bit of proteins in there. Transport proteins, for example, all right. Iron will sometimes, well, calcium is a great example, all right. When it's floating in your blood, you'll have free calcium, and when you go get your blood taken and they measure the levels of certain things in your blood like sodium, potassium, HDLs, LDLs, all right. Also, when they see calcium there, they're monitoring the calcium that's free calcium that's floating in the blood. That does not give a good indication of what's stored in your tissues at all, because where are we getting the sample from? The blood, okay? So keep that in mind. You'll learn more about this when you do circulation and talk about blood, but there's lots of things that float or are part of our fluid connective tissue when we're referring to blood. The other type is the lymph, okay? So essentially, the lymph comes from the blood plasma. All right. So when you sprain your ankle and whatnot, all right, a lot of that swelling, all right, it gets drained off into the lymphatic system, and the lymphatic system will circulate it throughout your lymphatic system, but it'll eventually get dumped back into your blood system. All right. And we'll talk about that. Well, we won't talk about it in this semester, but you'll see the lymphatic duct and the thoracic duct, all right, which are parts of the lymphatic system, dump the lymph back into your blood system, all right? So when we talk about the lymph, we will not have any cellular components, all right, or any parts of cells in the lymph, all right? Blood we will, okay, but lymph we will not, all right? Quick picture of the blood, okay? Did we do this in the lab? I think I briefly talked about it, okay. So anywho, what we're seeing here, all right, when we're looking at our blood smear here, right, you can see the red blood cells, it's a biconcave cell, all right, which looks like a donut. So when we look at it from the side, the periphery of the cell is kind of thicker, all right, but the center of the cell is kind of got like an indentation. That's why it looks pale here, all right. Then we've got some white blood cells. You got your neutrophil, you got a lymphocyte over here, and then there's, I don't see any in here. Supposed to be some small, there it is. All right, there's a platelet. The platelets are the smallest. They just look like little dots. There's only one on here. All right, but all this white background, that's the ground substance, which is our blood plasma, okay? That's where we'll have our proteins and a lot of dissolved components there. All right, on to the third type of muscle tissue, okay? So the third type of muscle tissue is, the third type of tissue in the body is muscle tissue. And there's three types. But again, when you think of muscle tissue, you want to think of movement, okay? That's what muscles do. They contract and relax. And when they contract, they create movement of some sort. All right, if it's skeletal muscle, it'll move around body parts. All right, if it's cardiac muscle tissue, it's going to pump the heart and pump blood. All right. It's smooth muscle. You'll find that in various organs throughout the body, right? Like blood vessels, helps to allow the blood vessels to vasodilate or vasoconstrict. Also, it's found in the digestive tract. That's how we move food through your small, large intestine, through your stomach, all right, into the rectum. Okay? So this is what we're going to break down each of these, but we're going to get into them in much more detail. So we're just going to kind of give you just a basic understanding of this type of tissue here. All right, and then we'll hit it in much more detail in chapter 10. All right, so the first one is skeletal muscle tissue. Okay? So two terms that you definitely want to know is that it's striated, which means what? Multiple layers, but it's striated, meaning it's striped. Okay, you got alternating light and dark regions. Okay, and it's voluntary. This is the only one that you can consciously control. All right. So its main job is movement. Well, what's it moving? The skeleton, parts of the skeleton. And we saw in lab, all right, that this type of muscle tissue, all right, the cells are very long, all right, long and cylindrical, and they're multinucleated. So we'll have nuclei, that's my version of a nucleus here, all over it, okay? And these long muscle cells, all right, will lay parallel to one another, not perpendicular, but parallel, okay? And so inside, all right, we have our what we call our contractile proteins. Again, we'll get into that more, right? But it's the positioning of these contractile proteins, the proteins that actually create movement and contraction, right, which creates the striations here. You do want to know this, all right, that the part of the nervous system that actually stimulates and controls the skeletal muscle system is called the somatic nervous system. The somatic nervous system is the part of the nervous system that you can consciously control, okay? So somatic nervous system is going to be the part of the nervous system that allows us voluntary control over the skeletal muscle, okay? All right, so keep in mind, all right, a lot of this you already know, the fact that it's striated, the fact that it's multinucleated, all right, and also that it is a voluntary muscle tissue. Now you know why. It's because it's controlled by the somatic nervous system, and that's the part of the nervous system that we can voluntarily control. You guys good with that so far? All right. We'll get in this in much more detail in chapter 10, okay? 10, yeah. All right, so here's a great picture, all right, of our skeletal muscle. Long, all right, cylindrical cells, all right, that are striated, multinucleated, and they're laid down in a parallel pattern. And they do not branch, okay? They do not branch. And they're voluntary, okay? So we have conscious control over it for our voluntary movement, and it creates movement of the skeleton. All right, the second type, cardiac muscle tissue, okay? It's found in one place only, okay? Heart. You can figure that out from its name. Cardiac, you're thinking heart, all right? Specifically in the middle layer of the heart, all right, which is called the myocardium, all right? It's the middle layer and it's the thickest layer of all three layers of the heart, all right? So we already know what its purpose is, all right? Its job is to cause the heart to contract and relax, all right? So that creates a pumping action, so it's going to circulate blood throughout the body, all right? This type of muscle tissue is also striated, but it's not as long as skeletal muscle tissue, all right? But it also branches or bifurcates. So I tell folks it's like laying the letter Y on its side, all right? That's the kind of configuration that you'll see, all right, with cardiac muscle tissue. Now, cardiac muscle tissue can have more than one nucleus like skeletal muscle tissue. It doesn't have as many. It can have one or two, all right, but it won't have like 30, all right, like skeletal muscle tissue can have. So you'll see, we've talked about this term before, the intercalated discs, all right? So you'll have striations in this muscle tissue, but then you'll see some really dark areas, okay? Those really dark areas are these intercalated discs, all right? And they have two purposes, okay? They help hold the cardiac cells together much more effectively, all right? So it increases the strength of the contraction and the stability, all right, of the actual muscle cells itself, all right? Because if you think about it, all right, your heart is beating 24/7. So we have to try to make it as an effective pump as possible. And so by doing that, by having these intercalated discs, all right, they're made up of two structures, All right, the first one is called gap junctions, and all a gap junction is a hole. So you literally have these holes in between the cells. All right, and the other one's called the desmosome, and that is just another anchoring point that strengthens the connection between the cells. So these two structures are found inside the intercalated discs. This one here, all right, helps with the rapid conduction of electrical activity. Okay, it allows that electrical current to flow faster, all right, because electricity, all right, flows faster through areas where there's less resistance. If you've ever taken a physics class, you know that, all right, and you'll get into the principles of that later on. So these holes, these gap junctions, all right, are just a way for that electrical current to flow from one cell to the next with less resistance, because the plasma membrane, all right, we'll talk about this in chapter 10. The plasma membrane is a barrier. All right, with osmosis, we learned it was a selectively permeable barrier. But that aside, it's still a barrier. And that barrier acts as a resistor. So it can slow down the path of electricity. Well, guess what? We found a way around that. We put a gap junction in there, and it goes right through the gap junction. It doesn't have to try to go through the plasma membrane. It can go along the plasma membrane, and we'll talk about that, but it's much easier when you have that gap junction. All right. Huge fact, it's involuntary, okay? So you cannot control the rate of your heart, meaning I can't just make myself right now, will myself to have my heart rate go from a resting heart rate of about 48 to 27. I can't. And I challenge any of you to. Because someone said that to me one time. They're like, well, what about those people that can, slow their heart rate down? So they slow their heart rate down by stimulating their parasympathetic nervous system. That's the rest and digest part of the nervous system. So they're using certain exercises to slow it down, which stimulates the heart less, so it slows down their heartbeat. But they can't consciously say to themselves, I'm going to make my heartbeat slow down. It doesn't work like that, okay? Okay. So we'll learn about pacemaker cells in 211. All right, so we cannot control this through the voluntary nervous system. We control it through what we call the autonomic nervous system. We'll learn about that in chapter 14 and 15. All right. Cardiac muscle tissue, here's a nice picture. I'll zoom in a little bit. Okay, you can see we still have striations. Okay, it's harder to see, all right, the cell bifurcating, but you can see a little bit of a bifurcation here and here. Okay, multinucleated. When I say multinucleated, I mean one or two cells, but you definitely see the intercalated discs standing out. All right. All right, questions so far? Okay, cool. All right, the last type of muscle tissue is smooth muscle tissue. Again, it is a form of involuntary muscle tissue, all right, and it's associated with a lot of the organs in our body, so another name for it is visceral, okay? You find it in a lot of the organs like the stomach, you'll find it in the blood vessels, certain areas of the pancreas, uterus, all over the place, okay? So this one here, and it makes sense, we call it smooth muscle tissue. Why? Because it doesn't have any striations, all right? It's smooth. This cell kind of looks like a football, kind of almost like a fibroblast, all right? We call it spindle shaped. But when you look at it, it looks like someone took a towel, all right, and they wrung it out, all right? When you twist the towel, like the middle of the towel gets big and thick, that's what this kind of looks like here, all right? Real easy, it's only got one nucleus and it usually sits right in the middle, okay? Look at this list of where we find it. Walls of the intestines, stomach, airways, bladder, uterus, blood vessels. It's all over the place, right? So it only makes sense that we call it visceral muscle tissue because it's found in all these different viscera, right? Again, being muscle, what is its job? Movement. It's going to move things, okay? So it's going to move things like in the walls of the intestines. You obviously can figure out what it's moving there. Same with the stomach. Airways, different story, all right? In the airways, it's going to manipulate the diameter of the airway. So if it makes it bigger, it's easier for air to flow through there. If it makes it smaller, it creates more of a resistance. It makes it harder for the air to move through there. Perfect example, asthma attack. All right, I have asthma, okay? What happens to me is something irritates my smooth muscles and my bronchioles, and they contract, and it makes the air diameter smaller. So it makes it harder for me to breathe, all right? Take a beta-2 agonist, which is any type of traditional, and that stimulates the smooth muscles to relax. Boom, causes my airways to dilate, which means they'll relax and get big again. Okay, so that's what we see here. Again, no voluntary control over this muscle. Okay, no voluntary control over it. All right, here's a nice picture. Zoom in a little bit. All right, so here's what I was kind of telling you about. All right, it's a spindle shape. It's almost like, it looks like someone's kind of wringing out the cell here. All right, but you can see there's no striations here. And each cell has its own nucleus here. No intercalated discs. Okay, it's a relatively short cell. All right, let's hit the last one. Nervous tissue. Okay, one of my favorites. So nervous tissue, all right, there's only 3 places that it's going to be located: in your brain, in your spinal cord, and then throughout all the nerves, excuse me, of your body. All right, everybody here has probably heard of the sciatic nerve. All right, so you've got the sciatic nerve, musculocutaneous nerve, median nerve, radial nerve. Point being is, those are all peripheral nerves. So you can break it down into 2 simple places. Brain and spinal cord make up the central nervous system. All right, and then the nerves make up the peripheral nervous system. Okay, so those are going to be the places that you will find nervous tissue. Okay, and the 2 types of nervous tissue cells that we're going to address. So first is the neurons. Okay, that's the one that we're going to spend most of our time on when we're studying the nervous system. Okay, and so their job is going to be relaying. They're going to be receiving information. They're going to transmit that information. All right, and that information we refer to as nerve impulses. We've got a couple other names for it: action potential, nerve signals. Point being is that these cells are made to receive it and then transmit it somewhere. Okay. The other type of cell is the glial cell. All right, this is the support cell. There's actually more glial cells than neuron cells. All right, but their job, again, you have to know this: they do not transmit information at all. Okay, they don't do that, but they do everything else. Okay, so they'll protect, all right, the neuron. Okay, they will provide it with any nutrition or sustenance. All right, and they also help to support the neurons, because sometimes neurons get damaged. Well, don't worry, the glial cells will help to repair the damage, so the neuron can actually return back to its normal function. Okay, so again, you do need to know about the glial cells, but we're going to spend more time talking about the neurons. Any questions at home? You guys are quiet. All right, no worries. You're doing great. Let's just quickly discuss a couple parts of the neuron. Okay, so the neuron is going to have, and we'll get into a little bit more detail physiologically. All right, about the parts of the neuron. I'm going to draw a horrible picture here of my neuron. And as I'm doing that, you can write down some notes. All right. All right, so that's my neuron. I'll put a nucleus right here. All right, so this first part here, this big rounded structure that I drew, all right, that's the cell body. And it has these processes that are coming off of it. All right, these shorter processes, we call those dendrites. And their job is going to be to receive information, and they can also transmit information. All right, but there are these processes that come off the cell body. Okay, inside the cell body, we have the nucleus, our control center, and then we'll have the organelles like endoplasmic reticulum. All right, you'll have ribosomes. All these little smaller structures all sit here inside of the cell body. Okay, well, if you notice, we have one big process that's coming off in this drawing here. All right, that's our axon. So a nerve signal is going to get started here. I shouldn't say a nerve signal. All right, we're going to try to create a nerve signal. So a stimulus can occur here, and if we get enough of a stimulus, it's going to start a nerve signal and transmit it down the axon. All right, to whatever's at the other end here. Okay, at this part over here, you could have another neuron, or you could have an effector organ. What is that? A gland or a muscle. Okay, for our purposes. okay? So keep in mind, all right, the axon is the long, big process that comes off the cell body, all right? And it's going to carry a nerve signal all the way down to the other end, all right, to either another neuron, all right, or an effector, okay? And we talked about what an effector is for this course. It's either going to be a muscle or a gland, okay? So it's pretty cool. These are the longest cells in the body. One neuron could be the entire length of a nerve. So you can have a neuron that goes the whole entire length of your arm. Pretty cool, okay? One that goes the entire length of your leg, okay? Nervous tissue is amitotic. It does not regenerate or divide, excuse me. It does not divide, okay? There's a few exceptions, okay? And we'll talk about that, but for the most part, it is considered amitotic tissue. So this drawing here, you can see here are our neurons, these bigger fellas right here. And you see the big process coming off. That's the axon, all right? Here's an axon on this other neuron. Then you have these smaller little processes coming off. Those are the dendrites. Here's the nucleus. Here's the nucleus in the cell body. And then these little dark dots here, those are your glial cells. All right, those are going to be the support cells. All right, put your hands together or wiggle your fingers. That's our way of clapping in karate class. All right, but we're done. We're done with tissue, okay? So we're going to step it up to the next level of organization, okay? So now we're going to get a couple tissues together, all right? And they're going to perform various functions, and we're going to create ourselves an organ, okay? So there's various organs in your body. Your bone, I always like, before I took anatomy, I never considered a bone an organ, but it is, okay? It's an organ, much like your stomach is, much like your brain, all right? Your pancreas, all right? Your kidneys, all right? Anyways, when we're looking at organs, we're going to see at least two. So are teeth organs? Well, I mean, technically, because teeth are part of bone, yeah, they would be considered an organ. As to whether or not, I'd have to look that up. I'm not quite sure if they can actually, I don't know if they make blood cells, to be honest with you. Was it really? Teeth or organs?
Yeah.
Okay.
It
Well,
was, I remember, it says yes.
it does, yeah, okay.
I remember
I
that.
looked it up, on Google, I looked up there, it's like saying it's a sensory organ technically.
Well, yeah, sensory organs, because
yeah.
they do have nervous tissue in there, and they're made up of two or more tissues. So, yeah, absolutely. Okay. So again, they'll perform, all right, more than one function. Okay, so you're going to see now as we start to take some of these different tissues. You saw it with the skin, for example, when we were talking about the dermis. All right, you had nervous tissue, muscle tissue in there. You had epithelial tissue because you have glands in there, and you have connective tissue. So we're going to see, all right, we'll hit on a couple different examples here. All right, where we have two or more tissue types involved in this structure. All right, that's going to be performing some functions. All right, that either work together, or you can have some functions that work separately. All right, but the first example that we're going to talk about is the stomach. I like to use the skin too because it has all four tissue types, but the stomach has all four tissue types. So when we break down the stomach, okay, the stomach, all right, we'll go tissue by tissue. The first tissue is epithelium. Your stomach is lined by epithelium, okay, specifically columnar epithelium. All right, so we're going to see, especially with our epithelium, all right, we're going to be releasing different chemicals, and we'll get into that when we do the digestive tract, like hydrochloric acid, for example, peptidase, which is an enzyme that likes to start to break down proteins. Proteins are kind of a tough macromolecule to break down, so your digestive tract tries to attack it at several different locations. It starts off in your mouth. Fats and proteins start to get digested in your mouth. Then your stomach keeps working on those, right? Because by the time whatever food product you ate has traveled through your intestinal tract, depending on how effective your intestinal tract is, you should have gotten all the possible nutrients out of whatever it was that you digested. The second type of tissue is going to be our connective tissue. all right? You're going to have areolar. Think about it. Areolar is a loose connective tissue. And one of the qualities of loose connective tissue is what? It's flexible, but it also has lots of blood vessels. It's highly vascularized. It binds too, that's right, because it's part of the packing material. But we'll have the areolar connective tissue, so we can get our blood vessels close by. Because remember, when we're digesting things, our eventual goal is to get whatever what we're breaking down, all right? It's called catabolic metabolism. You're taking something big and you're breaking it down into something small, okay? So our goal is to get whatever we ate or drank, break it down and get it into the bloodstream. So your bloodstream can circulate it through your body so it can deliver it to all the cells, all right? So we need to have blood vessels close by. So that's why we see areolar connective tissue there. We're also going to have a dense connective tissue because that's going to help provide that shape and support of the actual organ, okay? All right, the next tissue is muscle. All right, in this case, you have muscle tissue in the walls of the stomach, but you have them in 3 layers, and they're all perpendicular. All right, or they're not. What I should say is they're not going the same direction. Right, and I'll show you the picture here because I will not try to draw it because I won't do it the right justice. All right, because one layer goes this way, then another layer goes like up, and then another layer comes out at us. All right, so that's a horrible drawing. All right, I'll show you the next picture here. And then finally, the last tissue is what we learned, nervous tissue. Right, nerves control everything. So they're going to tell the stomach when to make stomach secretions, when to contract the muscles to move that material from the stomach into the small intestine. So here you can see an example of all 4 tissue types working together in concert in a series of complex functions, right, to perform a task. Okay? So when we switch over here to this slide, okay, you can see. Oops, where are you? All right, you can see here, all right, we have, well, we can really zoom in here. You want to see the epithelium here. We got our simple columnar epithelium, okay? And there's glands in here which are going to be secreting some of those gastric enzymes there. All right, but right below it and right underneath here, all right, our epithelium, there's our loose connective tissue, our areolar connective tissue with all the blood vessels. You can see the larger blood vessels then traveling up, and then we have the smaller ones like the capillaries in here, okay? And then it's also down in here in these pits here at the bottom, we'll see more epithelial tissue in the form of glands, okay? We go deep, you can see tons of blood vessels in here. And also we'll see some groupings of some nervous tissue here. And then below that, you've got your 3 different layers, all right, of smooth muscle. Because again, you ever seen those big cement mixer trucks rolling down the road? All right, and they got that drum on the back and it's always spinning because it's churning, all right, the cement so it doesn't dry. Well, your stomach does something similar to that. It'll contract in different directions and it'll churn and turn all the stomach content. So it mixes all the gastric juices into whatever it is that you ate and it mixes it up. Well, what's telling it to do that? The nervous system. The neurons, the nervous tissue will tell the muscles to contract and relax. And they're, at the same time, they're also telling the glands to secrete, all right, those gastric secretions into the stomach lumen so you can digest whatever it is that you ate or drank. All right. We talked about the body membranes briefly before. I just wanted to kind of bring them back up, all right, because we need to know these. All right. Body membranes, all right, are all made up of epithelium. Okay, and then right underneath it is the basement membrane, obviously, but underneath that is the connective tissue. Okay, we talked about, all right, how when we were learning about the serous membranes, okay, how they line the body cavities, and they'll also cover the viscera, right? At least the visceral layer of a serous membrane covers the viscera, which are the organs. All right, we learned how the epithelium on the outside of your skin and the epidermis, all right, covers the body's external surface, okay? That's the cutaneous membrane. That's the largest membrane, is the cutaneous membrane, because it's the largest organ, okay? So we briefly, when I was telling you guys about all the different types of stratified and simple epithelium that involve goblet cells, all right? What do goblet cells do? What's their job? It's a unicellular gland that makes something. Yes, that's right. It secretes, well, it doesn't secrete, this is the thing, John, that's, yes, you're right. It secretes mucin. When it mixes with water, then it becomes mucus, okay? So don't be fooled by that, okay? It doesn't make the mucus until it mixes it with the water, okay? But mucous membranes do many things. One, in our digestive tract, it helps to neutralize and neutralize the stomach acid, but it also helps to lubricate, all right, the digestive tract, all right? But in our respiratory system, you ever wonder why? Cool, I'm glad you got that, John. You ever wonder why would you need goblet cells in your lungs? I mean, the only thing you're breathing in is what air and exhaling carbon dioxide, along with a little bit of water, right? But why do we need goblet cells there? So exactly, traps foreign particles, and that's right, and it traps germs, all right? But one of the things, and I didn't tell you guys this, and I told my class last night, you guys have heard of antibodies, right? Okay, in our bodies we call them immunoglobulins. That's another name, all right? So there's a specific type of antibody, immunoglobulin, that is secreted into the mucous membrane. It's called IgA. Okay, there's IgM and IgG. Don't worry about that. But IgA is the specific type of antibody that's secreted into your mucus. So when you're breathing stuff in, all right, germs or whatever, viruses, those antibodies can attack them. Okay, so that's one of, all right, the purposes for these body membranes is for immunity. Okay, synovial, we'll talk more in chapter 9. The synovial membranes are found in any joints where there's a capsule, like your knuckles, all right, your knees. Synovial membranes secrete synovial fluid. The synovial fluid helps to nourish a joint, helps to create as a shock absorber for the joint, right? So we'll get into a little bit more detail about the synovial membrane. This picture just shows you all those different areas there. All right, so let's just quickly kind of run through these body membranes here, all right? So if we're talking about the mucous membrane here, all right, we're going to see it digestive, respiratory, urinary also, and the reproductive tract, because it has a big protective function, all right, also absorptive because we saw what it does in the digestive tract, but also a secretory function, obviously in the reproductive tract, especially for females, because during the act of coitus there, all right, it's important to have reduced friction. Urinary, same type of situation, all right? There's always a possibility of some immune compromise because of bacteria, folks, UTIs, things like that. So it's important that we're able to fight off those conditions, okay? So again, with the mucous membrane, I won't go into this, but we remember which type of epithelium has it. I hope you know, all right? But the connective tissue component there, part of what we call the basement membrane, all right, is this guy right here, the lamina propria, okay? And that sits right up below, all right, the epithelium there, okay? So for the most part, we saw the epithelium with the goblet cells, all right? But also considering that goblet cells are unicellular glands, all right, we still have the other types of glands, the secretory glands, all right, which will be multicellular. We saw that when we were studying exocrine glands, all right? And that will also be a part of the mucous membrane, okay, because that'll play a role in the digestive tract, especially when you're creating saliva and some of the digestive organs there. All right, that's the mucous membrane. All right, our serous membrane, just kind of a quick review of that, because we talked about it back in chapter 1. All right, this is the membrane that's going to line the body cavities. All right, it will not have any exposure, and I didn't mention this before. All right, it is not open to the external environment here. All right, but we refer to this type of epithelium as mesothelium. All right, because it's made up of simple squamous epithelium. Okay, so you have a layer of simple squamous epithelium because there's two layers that are involved with the serous membrane. All right, you've got your parietal and visceral layer here. Okay, well, in between those two layers, all right, we secrete, all right, our serous fluid, and its main job is to reduce that friction there. Okay, so the pericardial sac, which is what it's often called, but it's called the pericardium. Right? It's literally the sac that the heart it resides in. And it's got two layers that surround it. One that's directly on the heart, and that's the visceral pericardium. And then you've got the other part of the serous membrane is called the parietal pericardium, and that lines the inner portion of that the pericardial sac. Well, the heart's beating all the time. All right? If we didn't have serous fluid in between those two layers, those layers would heat up. All right? From the friction. So that serous fluid helps to reduce that. Okay? And that space in between these two layers we refer to as the serous cavity. Okay? All right. We'll talk more about the cutaneous membrane in chapter 6. Okay? But this membrane covers the external portion of the body. It's made up of that keratinized stratified squamous epithelium. Okay? Big, again, right? Big function of these membranes is protection. Okay, helps to protect the underlying organs. That includes your muscle. Right, that is also considered all right skeletal muscle organ there. Right? And then big role is to prevent water loss. Okay, it's not waterproof, but it is water resistant, so it will trap a lot of water and keep it both inside the body, but it helps to keep it outside the body. All right, and then our final membrane is the synovial membrane. Okay, this is the membrane that lines, again, it only lines some of the joints. All right, when we learn the joints, all right, this membrane is only found in what we call synovial joints. So hence, all right, it won't be found in a joint that is not labeled as a synovial joint. Okay, so this type of membrane is areolar connective tissue. All right, that's a loose connective tissue. All right, but it has that squamous epithelial tissue there. Big thing in this is that it does not have a basement membrane. But these cells will produce that synovial fluid, and there's several roles for that synovial fluid, but big functions for synovial fluid is reducing friction, helps to nourish the joint, it acts as a shock absorber, okay? If you think about it, our bodies take a lot of wear and tear, depending on your activity level, also depends on genetics too, all right? So we're like machines, so we break down too over time. So your body has developed all these different ways to help reduce wear and tear. Articular cartilage on the ends of long bones, that hyaline cartilage is great to help reduce wear and tear. Synovial fluid, same thing. It's great, all right, to reduce wear and tear.
Is synovial fluid what's associated with arthritis, or is that something different?
Well, if you ever hear someone saying they get fluid drained off of their knee, part of that is synovial fluid. Some of that is, inflammation too. All right, but part of that. Synovial fluid also, if you have rheumatoid arthritis, then you get this, they call it a pannus formation. It's this, how do I want to describe it? It's almost like a slime, like a scab, a better way to describe it, like a scab that will form in the actual joint itself and cause erosion of the joint. It will be found there. But the synovial fluid, if you have decreased amounts of synovial fluid, it can contribute to
So it's not
arthritis.
a cause, like less synovial fluid doesn't cause.
No. All right, so let's go to tissue modification. Let's wrap up this chapter by talking about tissue modification. These terms are very important that you know, and they will carry across other chapters that we're going to study here. So we want to get the basic understanding of what tissue modification is. And you might be familiar, all right, with some of these terms here, like hypertrophy, okay? And this is important because there's a difference between hypertrophy and hyperplasia. When you're talking about tissue hypertrophy, you're talking about size. You're increasing the size. So it's like bodybuilders, all right? When they go into the gym, all right, they have a certain size, but when they come out of the gym, they're a little bit bigger because they've been stimulating and exercising those muscles, so they've increased the size. Now you get some of those bodybuilders that decide to take anabolic steroids, now that's a different story, because now they're going to increase the size and the number, and we refer to increase in number as hyperplasia. Okay? So when you're growing up, right, when you're going through puberty, or even when you're going from a toddler into a young child, right? As you're growing more muscle mass, that's hyperplasia. As you're growing more bone mass, that is hyperplasia. You're going to increase the number of cells. All right, atrophy, you hear this quite often. Atrophy is when you get a shrinkage of tissue, but that is for both number, all right? It means when we talk about atrophy, it can mean either or. So you're decreasing the number of cells, all right, or you're decreasing the size of those cells. So we have one term for the decrease in size of cells or number, right? But we have two separate terms when we're talking about increasing the size and the number, okay? So as we get older, after the third decade of life, all right, you lose roughly about 10% of your muscle mass every decade. So you'll have roughly 10% less in your 40s, then 10% less in your 50s. But that's if you did nothing, all right? Anyone here know who Jack LaLanne is, or was, I should say? Jack LaLanne. I'm probably older than all of you folks, but I remember getting up as a kid on Saturday mornings when that was the thing to do. Cartoons were Saturday mornings. Well, if you got up early enough, Jack LaLanne, he was a man ahead of his time, big into sports fitness and whatnot. And it used to be that certain athletes, like baseball players, especially pitchers, they didn't want them to exercise and work out because they were worried that they would get muscle bound and not be able to throw the ball appropriately. Well, Jack LaLanne, said bollocks on all that, and he would train professional baseball players in secret. And anyways, this man proved, because he died at the age of 92 or 94, but in his 60s, he swam across the San Francisco Bay. And I think he turned 65 or 66, whatever age he turned, he pulled that many rowboats behind him. His point was, if you stay physically active, you can prevent that atrophy, and that's the point. Atrophy, right, is a normal occurrence with normal aging, okay? But also it can occur with disuse of an organ or tissue, meaning, right, if you're a coma patient and you're lying in bed for 5 years, right, you're not moving around, right, your muscles will start to atrophy, they'll get smaller, right? That's why a lot of times they'll have physical therapists or occupational therapists come in and exercise the person's body when they're just laying there in a coma. They'll do physical therapy with them so they slow down or prevent that disuse atrophy from going on. All right, metaplasia, important term, okay? This is what happens when you're dealing with, and you need to know this, mature epithelium. When it changes from one type to another. You see this in smokers all the time. And it's a form of adaptation, okay? You'll also see it with the people that have esophageal reflux disease in their esophagus there, right? Because the stomach acid is constantly irritating their esophagus. But here's the thing. So with smokers, all right, normally we know that the pseudostratified ciliated columnar epithelium, all right, is the normal epithelium there. We see that type of epithelium in large passageways of your respiratory system. But what happens now, the smokers, I don't want to use it, is attacking the respiratory system with the toxic substances from the smoke. And what happens is amazing. You'll see that epithelium transitions to non-keratinized, but not just non-keratinized, squamous epithelium. It completely goes from a columnar to a squamous cell. And it does that, as we know, because keratinized stratified epithelium is protective type. Any type of stratified epithelium is protective. So it transitions into that, and it'll stay as long as that person smokes. Crazy thing is, once they stop smoking, it reverts back to the pseudostratified ciliated columnar epithelium. It's really cool. And there's a study, it was done by Dr. Colin Campbell, and he discovered, and I don't know if you know this, some people will say, well, after 7 years of not smoking, your lungs are as good as they were before that. Sort of true, but what he found out 10 years after not smoking, and you could have been a 2-pack-a-day person, didn't matter. 10 years after you stop smoking, your chance of getting lung cancer is the same as somebody that's never smoked in their life. That's pretty good. Pretty good. Found that out in, I want to say it was the China study, but I'm not sure. All right. The other type of tissue modification that I want you to understand is dysplasia. This is abnormal tissue development. So we often call this precancerous. So it can revert back to normal, or it can actually continue on and become a cancer. All right. This is what happens quite frequently, and only a few of us would know of this, but pap smears all the time. You go in, if you've ever gone in for a pap smear and you get a report back from the doctor and they say there were some abnormal cells, all right? Most likely those abnormal cells were dysplasia. It happens all the time. When cells are dividing and constantly turning over, you're getting dysplastic cells in your skin, all right? But a lot of times those cells they die off, okay? Because a dendritic cell finds them, all right? Or the cell actually realizes that it's a dysplastic cell and it'll kill itself. Okay, there's lots of mechanisms to prevent that. The point being is these types of cells become abnormal, all right? And they can, in some instances, die off and proceed to become, dead, or they can proceed to become cancerous. That's why they refer to them as precancerous. All right, so we see the example here, all right, when women are exposed to HPV virus, all right, and that's one of the, I won't say few viruses, but it was that virus and hepatitis C virus that allowed a lot of medical professionals and PhDs, researchers, they learned that viruses can actually be a cause for cancer, all right, and they studied that. And actually, what's the name of that drug for HPV? The vaccine. Gardasil. Why did I say Cervidil? I was going to say Cervidil. Cervidil is a different drug. Gardasil. That was technically one of the first anti-cancer drugs, technically, because HPV can cause cancer. So this vaccine can help to prevent cancer. And so that's kind of the direction that a lot of research is going in. This is the big one. All right, the big C. Okay, neoplasia. This is new growth. This is what happens, all right, when you get some abnormal cells that start to just divide and rapidly grow. Okay, and as we get a collection of abnormal cells, then we get abnormal tissue. And there's two types. Benign, all right, which is what people consider to be, a non-threatening form of neoplasia, all right? It's a smaller or more localized growth, and it doesn't spread, okay? That's an example of that would be a mole or a nevus, okay? And then malignant, this is the more dangerous one, okay? And this term here, metastasize, means it can spread. And there's different ways it can spread. It can go through the lymphatic system, it can go through the blood system, it can do this process called seeding, where it can just spread from one organ inside your abdomen to another one. It just kind of spreads around, okay, like throwing a net out onto something, all right? So metastasizing is when the actual cancer starts to spread. And at one point, depending on how big the tumor or the type of cancer, it can start to interfere with normal functioning. And that's usually when you become what we call symptomatic, all right? And that's usually when people actually realize that they have some sort of neoplasia, right? Depending on how far advanced it is, because there's different ways to grade it, okay? It could lead to death, all right? So please be very, very familiar with those terms, all right? The last type of tissue modification is necrosis, which is tissue death, okay? Perfect example is frostbite. If it gets really bad, you can get gangrene, okay? So this type of tissue death is irreversible. Okay, it is an irreversible type of death. And a lot of times when tissue becomes damaged, it undergoes the healing process. And the first stage of the healing process is inflammation. So we'll start off with the inflammatory response to that damage. The tissue's trying to repair itself. It'll repair what it can, but in most cases, we've lost some tissue. We see that in gangrene. Somebody that's climbing a mountain is left outside all night, and then they get really bad frostbite that transitions into gangrene. Bad news. There was a mountain expedition in May of 1996 to Mount Everest, and there was a guy. He used to be a postman in Texas. He tried climbing Mount Everest 3 times, and every time he had to get turned back. Well, this time he made it up, but he didn't make it. Well, he made it back down, but he was left outside all night long, and he lost, I want to say, his ears, the tip of his nose. He had pretty extensive damage. This is the guy that, did you hear about the experiment where they were able to replicate tissue? They grew a human ear on the back of a mouse. Did anyone ever hear about that? It was for this guy. He was one of the first people that actually grew his ear and part of his nose on the back of a mouse when they were cloning tissue. So it was actually really cool. It's an interesting story. They made a movie out of it. It's called Into Thin Air. Anyone ever heard of that? John Krakauer. Decent movie. All right. Does anyone see Into the Wild? That movie with same guy wrote the book. So he wrote Into Thin Air. Did you see the movie? I heard they took the bus out of there. Did you hear about this? You know how I don't want to give anything away, but the character that was on the bus, they got rid of the bus.
Oh.
They said that too many people were going out there and dying. So
I mean, they know like there's so many different stories about every people dying on there. I mean,
yeah, so they
I
said
think
that.
every traveler sees like one person like typically like that's already passed away there.
Right.
You know, they just leave there. Don't touch it all.
Are you talking about up on?
Everest, yeah.
Oh yeah. There was a guy. I just saw an article this week or last week. There was a guy that's been there for so long. I think they just gave him a name for the color. I think they called him Old Blue or something. I don't remember.
Like a green jacket.
Maybe it was that guy. Yeah.
He passed by like every time you go up there. That's why.
Nope. And they just leave him there. All right. Let's finish up here with the last part. This is going to be a common pattern that you're going to see when you study all of these different systems. Okay, so when you go through cardiac system, digestive system, we'll see it with skin. A lot of this will apply to chapter 6, but we're going to, at the end of each chapter, we're going to talk about what happens to these tissues as we age. Okay, so in normal individuals like all of us, I'm hoping right now, we should have proper nutrition. We should have pretty decent circulation because I'd like to think that we take care of ourselves. All right, so with proper nutrition, good circulation, if we hurt ourselves, our tissues will regenerate and our wounds will heal, okay? And so we're going to see that. So all that is what we consider that to be normal functioning, all right? But as we get older, okay, things slow down. That's a common idea that why you keep in your minds, okay? As we get older, you've seen older people, they can't run as fast as they used to, all right? Not to say they can't run, but I'm just saying they just can't run as fast. You know, they slow down. Well, the same thing happens to our tissues, to our cells. Metabolic processes start to slow down. So whatever those metabolic processes we're involved with, perfect example, collagen synthesis, all right? You make collagen great right now. But when you're 90, you're not going to be making collagen all that great, all right? So where do we find collagen? In most of our tissues, in our skin. That's why when you hear that older people, their skin is thinner, part of that is because it's decreased. Why do you think that older people have what they consider to be brittle bones? Collagen is a big ingredient in your bones, and we'll talk about that, all right? So just kind of keep that in mind. As everything slows down, all right, everything that we're going to be efficient in, you know, in creating substances for support, maintenance of tissues, replacement of cells, and even the extracellular matrix. Part of the extracellular matrix is collagen, right? That becomes less efficient as we move past our what they consider our middle ages, which to me, I would say 50s and 60s, because we're living longer. You know, I'm optimistic because I'm getting closer to those ages, but still, all right? So you're going to see, all right, this stuff start to kind of slow down and deteriorate. So quickly, skin gets thinner, okay? Our epithelial gets thinner, all right? The connective tissue loses its pliability and resiliency, all right? A lot of the ingredients in connective tissue is collagen and elastic fibers, all right? So if you're reducing collagen and elastic fibers, you're reducing the strength of the tissue and its stretchiness, so it won't be as resilient, okay? So collagens decline, bones become brittle. Why? Because collagen declines, all right? Muscle and nervous tissue, they start to atrophy. Like I said, after your third decade, into the fourth decade of life, every decade after that, you lose about 10% of your muscle mass. All right. Now, this can be slowed down, all right, by eating right. right? If you have a great diet and you're giving your body the ingredients that it needs, you can slow that down, okay? And also keeping that circulation, because remember, your circulatory system is the system that is the transport system of your body. That's what delivers nutrients to all your cells in your body, okay? But it also picks up the waste. So if you got a crappy circulatory system, your tissues will suffer for that, okay? Oh, that's it. All right, that was the last slide. Phew, that was a lot. All right. Okay, so that's all the material that you are responsible for on the test, okay? Into the skin, but is there any questions on what we just talked about? No? Okay. No big deal. All right. So let's go into the skin. Some of this is going to be a review because we talked about it in lab, okay? Which is nice because of timing and whatnot, and I like to kind of review things a little bit here with you, okay? So on the lecture study guide, all right, one of the questions, actually question 2 for chapter 6 was, what's another name for the integument? So people put skin down, and that's fine, but this is the answer that I was really looking for. Is the, cutaneous membrane. You weren't wrong if you put skin, all right, but that's the one I was really looking for. So another name for the integument, all right, skin, is the cutaneous membrane, okay? And one of the things that we talked about when we were talking about the functions of epithelium and also the cutaneous membrane is that it's a protective barrier, right, on the external surface of whatever. In this case, it's the external barrier on our body. So it's a barrier to the outside world, right? The world is a very difficult place, right? And there's always something trying to bring you down. If it's not the man trying to bring you down, it's a bacteria that's trying to bring you down, or a virus that's trying to bring you down. All that stuff is on your skin. Well, not the man, but you know what I mean. Like bacteria are living on your skin. Viruses live on your skin, all right? And they're trying to always get inside. And that's what they're trying to do. Well, one of the things that I love about the skin is, yes, it's a visual indicator of your health. So when I come out to greet a patient in my waiting room, I'm doing an evaluation as I'm talking to them, but I'm looking at them. I want to see what they're looking like. If their skin's yellow, what am I thinking? Jaundice. Yeah. I'm thinking jaundice, so something's going on. So one of the things I'm thinking is liver. There's probably something going on. If someone's face is red, like just bright red, well, high blood pressure, but their blood flow, all right? They've got a lot of vasodilation going on in the thin skin of their face, so something's going on there. Are they feeling okay? Are they, if they're sweating, okay? Point being is, it's a great way to kind of tell if somebody, they're a part of the way to tell what type of medicine do you practice, your specialty. Just curious. I'm a chiropractor. I was going to type that out, but I don't feel like that. All right. But I study as much as I can. Sweet. All right. And then, of course, this is the hardest specialty to get into if you're thinking about going into medicine. Okay, just to let you know. On the step exams, which is the United States medical licensing exam for doctors, this one here, you have to have a very high score. At the time, I think it was probably higher now. It's like 250, 260, even now. You got to get a high score. But anyway.
And to find out what, like, how many points there?
It varies, because it depends. But I think usually you get 170 or 180. And it's they base it on the population of people that took it at that time. But it's really close. It won't shift like 100 points or anything.
Yeah.
But usually around 170, 180 is to be what's considered to be passing.
Okay.
And then they kind of look at your scores, and that helps to determine, because certain specialties are like, well, you need to have at least a 220. But dermatology, they got the best hours. I mean, when have you ever seen a dermatologist working in the ER on a Friday night? They do, though, and I know that only because my daughter, pardon? Oh, yeah, they're very busy.
Get up one in like 4 months in
Oh, yeah, you do. I mean, again, exactly. Yeah, dermatologists. My daughter got bit by a dog when she was like 4, 5, and there was a plastic surgeon who specialized. They were dermatologists and they went into plastic surgery. But they were on call at the ER. I'm like, I didn't know they even had plastic surgeons on call in the ER. All right. So let's talk about some of the functions of the skin. Okay. Obviously, all right, since it's a barrier to the outside world, it's going to protect. Okay. And it protects us from, all right, what do we consider harmful substances? Anything that shouldn't be in our body. All right. So it could be certain toxic chemicals. It could be bacteria. It could be viruses. All right. Anything that shouldn't be there. All right. Ultraviolet radiation. Okay. It helps. What protects us from that? The melanin in our skin. Okay. From injury too, because remember now this barrier, thick skin on the bottom of our feet helps to protect, right, those more sensitive structures that are deeper. Same thing with the palms of our hand, right? That will help from injury. You fall down, right? You're not going to put your elbow out to break your fall, all right? No, you're not. You're going to put your hands out, all right? There's a little bit more cushioning there, okay? All right, this is huge, all right? Prevention of water loss or gain, all right? Obviously with dehydration, okay? One of the big things that when you get third-degree burns on your skin, and if it's over 50% of your body, 2 major things that they're concerned about with that type of situation is 1, infection, and 2, dehydration, okay? So the outer layer is, like I said before, it's water resistant, but it's not waterproof, all right? So you'll lose water, all right, when you exhale, all right? But through your skin, you lose it through sweating, right? But also transpiration is also through the sweat glands, but when you're not in a sweating state, they'll let out just a little bit of water vapor here and there, you know. I don't call it like a relief valve, but that's what they do. They let out a little bit of water. We'll get to learn about this later on, about the metabolic regulation of vitamin D, okay? Huge. In this course, we don't cover a lot of the properties of vitamin D. It plays a huge role in immune function. All right, people don't realize that. And it's been shown to help decrease certain cancers, certain leukemia cancers. All right, but that research is still ongoing right now. But the interesting thing about vitamin D, all right, when we go to what's up here on the board, is how it's synthesized in our skin through sunlight. Okay, because vitamin D plays a regulatory role for calcium levels in our blood. Okay, so when blood calcium is low, all right, vitamin D helps 2 things. It helps the kidneys to absorb more calcium so you don't pee it out, okay? And it helps to maintain with the absorption of calcium in the digestive tract, okay? But we'll talk more about that later on, okay? When you have low blood calcium levels, all right, vitamin D, all right, helps to increase calcium from the digestive tract, but also helps to maintain or keep the kidneys from getting rid of any calcium. And phosphate, what do we need phosphate for? Energy production, ATP, baby. All right. So some of the other functions here for the skin, all right, secretion and absorption, all right. What I did mention earlier, that the skin is a selectively permeable membrane, okay? So great area. Did I tell you guys about my fentanyl dog? Yeah. We had to put I didn't do it, the surgeon did. Put a fentanyl patch on him when he had surgery, right? And it's because it's a great way for a nice slow release of a drug, right? Because it's a permeable membrane, so you can regulate the amount of drug that's actually entering into, all right, the subject. Nicotine patches, right? Another way to do it. You can get that slow release of nicotine, all right, for folks that are trying to quit. Immune function, we talked about the dendritic cells, all right? Those are the Langerhans cells that we found in the stratum spinosum there of the epidermis, right? But also you'll have other immune cells in there, other white blood cells, all right, that will help to, 1, attack any foreign invaders, all right, like bacteria or viruses, but also if there's any precancerous or cancerous cells, they like to take out those things. Temperature regulation, remember back in chapter 1, where we talked about the negative feedback loop and how we had one guy sitting on the bucket fishing, all right, and we'll see vasoconstriction of the blood vessels, to move blood away from the surface of the skin and keep the blood towards the core to keep your organs warm, right? And then vice versa, when someone's out there chopping wood and they start to increase their body temperature, then we get vasodilation, right? So the blood will accumulate towards the surface of the skin, and so that heat in the blood will be given off. And then, of course, sensory reception there. We have tons of different types of nervous tissue and nervous receptors in the skin. We'll see those types of receptors more in chapter 16. But we saw, all right, that Merkel cell there, that touch-sensitive cell, that when you touch it, it would release a chemical in the epidermis, and it would, and that's in response to light pressure. All right, we have tons of receptors for light touch, deep touch in our skin, and even vibration and pain, obviously. I'm forgetting one of the important ones. All right, so kind of a quick review, folks. All right, layers of the skin. All right, now keep in mind, this is not a layer of the skin. Okay, epidermis is the outer layer of the skin, the superficial layer. All right, and that is made up of stratified squamous epithelium. Okay, the deeper layer, all right, the dermis, that's primarily made up of dense irregular connective tissue. That's the predominant type of connective tissue in the dermis. Okay, and then the layer below, all right, the integument system is the subcutaneous. All right, not a part of the integument. Okay, not a part. All right, and in the subcutaneous, it has these two tissues. All right, adipose and areolar. They're both loose connective tissues. So keep that in mind. It is not part of the integumentary system. Questions so far? This is review. Does some of this look familiar to you folks? All right. Well, that's not a bad thing. If you're getting bored, that means you've seen it and you've already been, oh, all right, I've seen this already. All right. Let's talk about the epidermis. Okay? The predominant, well, the epidermis is epithelium. Okay? And the predominant tissue, epithelium that's there is keratinized, stratified squamous epithelium. So what does keratin do? What do we say about keratin? What is keratin? Kills. Keratin kills. Okay? So in the epidermis, we've got, that's right, you got it, Robert. There's 4 to 5 layers, okay, or what we call strata in our epidermis. Okay, so we're going to go from deep to superficial. So the stratum basale or stratum basal is the deepest layer. The stratum corneum is the most superficial. Okay, so in these bottom 3 layers, that's where we're going to see the living keratinocytes. This layer here, the stratum granulosum, that's where they'll start to die. Right? That's the layer that they start to produce the keratin. Okay? I'm going to go through each layer like we did in lab here briefly. Okay. First one here, stratum basale, also known, and I've seen this asked on tests before, so you might want to write this down. It's also known as the stratum germinativum or basal. Okay, please, 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 just make a note of that. All right. So this, obviously, we're starting with the deepest layer, okay, and it's epithelium, so it's going to sit right on top of the basement membrane. That's what BM stands for, by the way. All right. So in this layer, okay, now I've seen it described 3 different ways. Okay, this layer, the cells will look to be either cuboidal or what we refer to as low columnar, and I've also seen them described as being polyhedral. Point being is, it doesn't look like a squamous cell. Okay, that's the takeaway message that I want you to understand. Okay, so in this layer does not, but remember, when we're naming stratified epithelium, which layer do we name the epithelium? What the appearance? You guys remember? Stratified epithelium. Remember how we name epithelium? We name it by the number of layers and the shape of the cell. That's right. That's right. Apical. So when you're looking at stratified epithelium, okay? You look at the top layer, and then you see what the shape of the cell is, and that's what you name all the epithelium for. Because like I said here, this epithelium looks to be cuboidal or locolumnar, but when it starts to migrate into the upper layers, into the more superficial layers, right, then it takes on that stratified, that squamous appearance then. All right, so we always name it for the apical layer. Good job, both of you at home. Okay, so there's 3 cell types. We've already seen this, so I'll kind of move through this. All right, the predominant one is the keratinocytes. All right, we all know what they produce. Okay, they produce their namesake. All right, keratin. Then we got melanocytes. All right, they're going to make and store the melanin and share it with other cells around them. But that melanin protects our DNA. Okay, and then we got the touch cells or the tactile cells. We also call those Merkel cells. These are the ones when there's a compression going on, they release that chemical, that neurotransmitter. All right, and that's going to stimulate a close by neuron, and it sends that information to the nervous system saying that there's something here, that I'm touching something or something's touching me. Okay, so those are our tactile cells. All right, so the keratinocytes. All right, obviously, I think at this point, I've said it so many times, you've already figured out what it's making. All right, but you need to know that it's a protein, and what does it do? It's going to strengthen the individual cell, but as a whole, it's going to strengthen your epidermis. Okay, it makes it much more stronger and resilient. Okay, so in this layer, all right, these cells are constantly dividing. Okay, so they're stem cells. They're constantly dividing. So when they divide, one of those cells will stay in the layer, and the other one will move up into the upper layer. Okay, and that's what they're doing. So they're constantly dividing to make new cells. All right, the melanocytes, we'll also see them scattered throughout this layer. All right, they make and store the melanin. All right, and it's from sunlight, and that specifically from the ultraviolet radiation from sunlight. All right, or a tanning bed. Okay, and so they'll actually share. All right, they're like the kindergartner of these cells, and they'll share, all right, the melanin with other cells nearby. Okay, but its main purpose is to shield the DNA from that ultraviolet radiation, so that DNA doesn't get split. Okay, it's called dimerization. You don't even know it, but again, I've been asked that, and it just keeps it from. If you split the DNA, you damage the DNA, and then you can start to have mutations and all sorts of issues. And we don't want that. All right, let me finish up with this slide here, and then we'll call it a night for lecture. Okay. All right, the last one is the tactile cells, or Merkel cells. All right, touch sensitive. When they get compressed, they release the neurotransmitter, the chemicals there, and that will stimulate nearby sensory nerve endings. All right, to transmit a signal to the nervous system saying, I'm touching something. All righty, let's take a break, because I know that a lot of people are probably, yep, all right, good. I'm sure a lot of people are probably full of information here.